Hello everyone, this is your sister, your doctor, Victoria Adepoju, and I'm here today to talk about your application for Mandela Washington Fellowship 2022. So stay tuned and let's go through it together. Now, in the first instance, they will ask you to talk about yourself. How do you talk about yourself? This is a general thing. In every instance in life, they will always ask you about yourself. So if it's something that is looking strange to you to describe yourself, to describe what you do, or to talk about you, how do you talk about you? There's a saying that if you don't blow your own trumpet, who will blow it for you? So nobody will. Now, talking about yourself, normal introduction. You are so, Mr. something that work for this organization or that own this organization. You describe yourself, you describe your work, you describe your environment where you are doing the work. After talking about the organization that you are working for, what is next is talking about what you are passionate about. I'm Dr. Victoria Adepoju. I work for African Development and Empowerment Foundation. I'm the managing director of Gibbs Clinic, Akobo in Ibadan, and I'm passionate about maternal health and newborn health. You know, newborns don't talk; they cannot do anything. They are vulnerable groups. So you talk about what you are passionate about, the people that you are saving, the people that you are making impact in their lives. So from there, they can see that this person is really passionate about this work or this project, or no matter what you are doing. I think that's what is important. This video is actually for the people that is already in the space, mature minds. If you are somebody that you don't know how to do all those things yet, we are going to come back to you in another video. How to describe yourself, how to describe your work. That's going to be a video for another. But people that already understand what I'm saying are the people that I'm talking to. You know how to talk about the work that you are doing. So what is next? The impact that you are making. I think that should be another question after describe your work, your profession, and the impact that you are making in the work. Now, when they talk about impact, a lot of people will just summarize. You summarize what you do. This is what we do. We reach this community. We save vulnerable people. We address less privileged. We give them food and we give them clothes and we go back to our house. No, that's not how to talk about the impact that you are making. When you are asked to talk about the work that you do and the impact that you are making, you are supposed to first go into the problem of the statement. Problem statement. What is the problem on ground? And when they ask you to talk about the problem on ground, you are not going to just start talking about mothers, when they get pregnant, they will die. In Nigeria, there's no this, there's no that. No, you go right into evidence-based data. What is the status of the problem on ground? According to WHO, according to UNICEF, according to, you talk about data. That is what the scientific world want to hear, because this is a kind of fellowship that have to do with schools. Mandela Washington Fellowship is owned by an organization, IREX. Then they link you to a school where you are going to be for like 6 weeks. They train you. So it's a standard scientific fellowship. So you have to learn to write scientifically. You back up your problem with data to know the weight of the problem on ground. So when you are able to describe the problem, then what are you doing about it? You also go into the solution available first before you now talk about how you and your solution is going to actually be beneficial to the affected population. So now, for me, 86 over 1,000, when 1,000 people are pregnant, about 86 of them will die from pregnancy-related complications. Now, in Nigeria, this is the reason why they die. This is the reason why they die. There's no transportation, there's no money, the health system is not good, the healthcare workers are not available, no train, a lot of them deliver at community where there's no skilled professionals. So when you talk about the problem on ground and why the problem is more related to us here, then you can now talk about how you are intervening. What are the steps that you are doing? What are the things that you are doing as solution that is reducing the burden of the problem? So when you have been able to talk about the present solution, what other people are doing about it, then you talk about what you think your work how you think your work can have impact on the ongoing problem. So when you are able to package your work that way, don't forget to talk about data. Don't forget to talk about your impact numerically. We've been able to reach 400 women. We've been able to deliver, in fact, this year alone, we've delivered over 50 babies safely without any complications or complication. So you have to back it up with evidence. We'll be talking about how you are going to be able to describe your work in another video, especially for people that are just learning and they're just getting into this space. You have to know how to talk about your work. So we'll talk about that later. But like we are saying, this is for the mature mind, people that are already in this space. Now, after they've asked you to talk about your work, there's a part of the question presently for this 2021 that talk about how you are able to grow professionally during the era of COVID-19. I think that question is a trap. They want to know that you are not just somebody that will just sit back and say there's problem, so my work have to stop. For instance, this COVID-19 pandemic almost affected our homework. We are health professionals. We almost closed shop. I think we started our clinic during the pandemic season. The hospital actually started in February, and that February ending, pandemic started. So we were at a crossroad. Should we close shop or should we open shop? Because when people are sick and they see hospital, they will come inside now. And I have a baby. I don't want to die young. I don't want my baby to die. So we have to call a group of people. Should we close shop or should we try and see how it will go? And everybody agrees. Nobody is forcing work on anybody. Let's just close this shop. We are just washing the house. We are just cleaning. We are just buying materials and equipment. Let's just close shop because COVID has come. Let's try, let's open, let's see what we can do. If you see people that have symptoms of COVID, we turn them back to go to either UCH or somewhere else. Okay, that's our conclusion. So they want you to talk about what you are able to do during COVID-19, how it helped you to grow, how it helped you to make some impact. And I think it's an opportunity to also show off and let them know that you are somebody that can face challenges, somebody that can, stand in the face of adversity. So they always ask that question. They will ask you during the interview that if you see problem, how do you overcome it? Do you get? Is one problem, one question that they normally ask, but they modified it this time that during that COVID-19 pandemic, how were you able to work? How were you able to grow in your profession? So what were you doing during COVID-19? They don't want much. Talk about how COVID-19 and your work are related. How in February, March, April, they will still come. They don't know that there's any lockdown. They don't know that there's any pandemic in the world. So you cannot stop babies from coming to the world. And that's the reason that we have to stand in gap. We have to be ready to support these pregnant women. We were able to mobilize police officers because during lockdown, in fact, there are so many instances that people want to come from primary health care center to come and do ultrasound scan in our facility. We have to link with the health worker. The health worker will call us that this so person wants to come, but there's no transportation, there is lockdown. We send our ambulance to go and carry the patients. We also return the patients back to the primary health care center. There are instances that they have complications at primary health care centers and they're calling us to come and help, and there's lockdown. No movement, no transportation. They cannot even get a bike to carry the pregnant ones. We have to stand up and look for our driver in the middle of the night to go and carry them and bring them back. And sometimes we have to call the police station so that they can know that we are the one. A lot of strange faces are on the road, stopping people that are walking. What are you doing on the road? Don't you know about the lockdown? So we have to work with a lot of groups. Our vigilance in the environment, we have to wake them up to open gate and all that. So we were able to survive. But the truth is, you too, you can feel me the way I'm talking about what I experienced with COVID-19. That's the way they should be feeling you. That's wow, this happened. There are instances where we got stopped. We have to look for our ID card and put it in the car. That we are doctors, so I beg we are doctors, so they are calling us at the hospital. Surgeons that will come and do surgery in the midnight. We have to go and stand on the main road for him to meet us there so that nobody will challenge him. We have to call police officers in the middle of the night to help us talk to their colleagues on the road. So there's a lot to do that we did during that COVID-19 pandemic. It was strenuous, more stressful. And our patients, they don't have money that they can use to appreciate us. So we are just doing it for God. Even after doing all those things, they will still say, why is your money like this? Ordinary 15,000 is too much for delivery. A lot of things that we went through that we cannot force them to pay because we know they don't have the money. Even if you want to add the money for transportation of the ambulance, they've not even paid the money for delivery. So how are they going to be able to, to afford other things that you say you want to add? So those services, they went free. So that's how you are going to talk about what you are able to do during COVID-19 pandemic. How is it related to you? In your workplace, were they allowing you to come to the office when they were not allowing you to come to the office? What were you able to do in your house to still ensure that the work is progressing? Are you able to communicate with your boss, your staff, your colleagues, to ensure that you are still making impact and you are still reaching out to the population that you are targeting? So those are the things that you are going to be talking about in that place. There's another question that is about your professional development, your work relating to your profession. I think what you did in school or what you are actually using to work. What course did you do? How's your solution that you are providing? How is it related to your profession? It's simple. I'm a doctor and I'm saving lives. I'm helping mothers, pregnant women save lives. I'm saving lives. So let's say you are an accountant or a sociologist or whoever you are, and the impact that you are interested in, are you using your profession to assist in that regard? Just link them up and you are good, home and dry. So in that area where they're talking about your profession, they want to know your professional accomplishments. Let's say you are a photographer. What is your professional accomplishment? In what regard are you using that your profession to make impact? Oh, let me give you an instance. There's a young guy that I met during Yali, West Africa. He learned graphic design, Photoshop and all that. And he's working with, I'm giving you an instance so that you can understand how to link these things. He's working with an organization, a church. He's in the tech department in the church. Oh, they are asking him to talk about how he's used his profession to make an accomplishment, your professional accomplishment. So in his own essay, when he was telling me, he told me about the fact that he was able to mobilize church members to his own group, that's the tech group. He was able to organize teachings for them, trainings for them to learn graphic design. He was able to train like 200 plus students in his part 2, in his part 3. He's still in university and he came for Yali, West Africa. So in his part 2, in his part 3, the number of people that he was able to train in that department in the church, that's why he used to get his own scholarship and the training opportunity. So whatever you are doing, it's possible. You are accomplishing something every day. So you can talk about what you are doing in simple layman English. Now, let's continue. Let's talk about how you are going to write all these things. Don't write ambiguity. Don't write too much vocabulary. Explain in simple terms. Back it up with data. Give examples. They like stories. For example, when I was here in Anambra, I was able to join this organization that is doing this. When I joined them, they asked me to do this, and I was able to bring it up and I was able to accomplish it. I followed them to so. I was able to make collaboration with an organization in this so place. You know, just write in simple terms, simple English that people can understand. Add stories to make the clarity come out, and you're good. Question. Okay, I forgot one question about what you are now going to do in the future. Very important. After this training, after Mandela Washington program, if you are given, what are you going to accomplish in the nearest future? Because they want you to be somebody that is planning. As a leader too, you have to have a plan. A leader is the person that is directing the wheel of the car. So if you don't have a destination, where are you leading everybody to? Do you understand? So you have to have a plan. They want to know what plan you have for yourself in the nearest 5 years, in the nearest 10 years. What do you think you can accomplish? So think about it from your program, from your impact, from your project. What is your target? Do you want to be able to train 100 people, 1,000 people? Do you want to establish and increase, have 2, 3, 4, 5 branches? Do you want to continue training people? Do you want to establish a school in the future? Do you want to establish more facilities in the future? Do you get, just have a plan. Have a plan for your life. And if you want to go into academics, don't be shy about it. They don't want you to be like this. They want you to be straightforward. You want the training to add this to you so that you can accomplish this in the nearest future. Simple layman English that everybody can understand and relate with. So if you have more questions, put them down in the comment section. We will address them one by one. If you have clarification, if you are somebody that have been to the program, you have done on the Mandela Washington and you want to make contributions, just add them in the comment section. People will read it and add to their knowledge. Thank you very much for watching. Once again, this is your sister and your doctor, Victoria Adepoju. See you in the next video.